US time. Sure, it's afternoon after Asuri Uganda time, UK time 2:30. Tubeebaziza nnyo okubeera nga mutujoinize on this session ey'okuyiga about diabetes. Oba mu Luganda okuyiga ku sukaali. Simanyi lwaki bamuyita sukaali naye alhamdulillah tugendera awo. Dr. ajja kutuwa bulamu. As usual, we are working with Sister Habiba. Our other teammates, tebadde tebaliiko. Sister Naima, Allah muteke mu dua. Mama badde mulwadde. Ne Hajat Sara naye ali ku mulimu. Naye alhamdulillah weetuli. Sister Neufa naye mwali mu class ya leero she's a nurse in UK. Naye wali to continue with helping us with the session today. Alhamdulillah, tuina Dr. Edrisa Mutebi. Dr. Mutebi, should I give the intro about you or bambadde nkusaba ndooza intro gitubuulire who Dr. Mutebi is? Okay. I know you. Yes, sir.
Okay, thank you very much. Tukuita doctor, tukuita
City doctor, the regular person, Hasfa Kasuja.
Okay, Hasfa.
Yes,
Hasfa, it's a pleasure with the whole team.
Yes,
it's a great pleasure that Hasfa and the team invited me to talk about this important subject. And I didn't get the details well enough. Do I have to mix in a little bit of Luganda or it's totally English?
It's mixed. Whatever makes you comfortable, Doctor. Luganda, Luzungu, Kasav Kanyama. Whatever makes you comfortable.
Okay. Okay, wonderful.
Yes, sir.
So, I'm very grateful for having had that invitation. And I'm Dr. Mutebi Edrisa. I'm of endocrinology in Molago Hospital. And I also lecture with Makerere University. And I've been practicing diabetes management for the past, since I qualified as a doctor in 2000, and I went master in 2003, still authorizing again in the area of diabetes. So we've been treating patients with diabetes over the past 15 to 20 years. And it's a great pleasure that I'm going to present today a topic which is very wide, but we shall try to minimize and bring out the important bits so that to be comfortable with this disease.
Yes, sir.
That's why I call it diabetes mellitus simplified.
Yes, sir.
We are going to try and pin out the important things that we think can guide us for those who don't have the disease, to prevent the disease, and those who have it already, how they can swim through to be able to control it. And in these slides, I tried not to go technical. I tried to really keep myself to the simple levels. So people who may be really technical, maybe if there are any doctors on the platform, medical doctors, this may seem a little bit simple for them because I prepared this for the general public, really for the health workers. But nevertheless, the health workers may also pick one or two things that can guide Nechibayamba to improve their care as they look after these patients.
Okay, inshallah. Thank you very much, Doctor, for the introduction. Whenever you're ready, maybe question, Doctor, do you want to first give
my thinking is that it is always very nice to,
yes,
before I start, because I prepared some slides, but it would be nice to get a feel of what people out there may want me to, the areas they may want me to address, or particular things that are of concern to them. For example, somebody may ask, oh, doctor, should I eat fruits? Do fruits affect diabetes? So that when I talk, I can lay particular emphasis to some of those areas people may have raised.
Okay, let's see what Sister Nilfa.
Doctor, assalamu alaikum rahmatullahi wa barakatuh. I know you,
Alaikum
doctor.
salam.
I last saw you, I think, almost 15 years ago when you were still at
Wonderful. Wonderful.
So
Wonderful.
I think I'm a nurse now, qualified nurse for over, it's 20 years, I think now. We discussed this topic with my sister Hasfa, who is the chairperson leading this. What we would really want, we're having problems with our people not knowing the diet. There's also a fright, a stigma. So if that fright and stigma gets out of diabetes, and really what people should actually eat, and there's so much herbal medicines, people believing in herbal medicines, people don't know why they get diabetes, what causes the causes really, and the symptoms. I think that would be a very good way to start.
Okay, wonderful.
Inshallah.
You seem to have covered the whole scope.
Alaikum salam. Dr. Mami Sulaiman, but there one is Mukono. I think he's put his arm down. Do I see it? There's a hand up. Let me just give him. Mami Sulaiman, Chairman, Sebo. Chairman, Baden Kwada Kazinda.
Assalamu alaikum wa rahmatullahi wa barakatuhu.
Wa alaikum assalam wa rahmatullahi wa barakatuhu.
Nze Sulaiman Nsubuga, mukulu Mutebi rabika izo kuba tetumanyiganye as such. Nenga ndi dental hygienist by professional. Wano mu UK era wano wenkolerako mukulu zaidi ngata nagenda Kampala nsoka mukolerako wano mpola kubyakamu. No.
It's a pleasure. It's a pleasure to meet you.
Yes, thank you. Now, as we know, the body is one body, and there's a lot of research now coming out connecting the mouth and these kind of conditions, diabetic, blood pressures, and heart diseases and whatever. So and there's some research from Sweden actually, which was done. They got a number of people with diabetic. They checked their blood sugars before oral hygiene, kind of professional cleaning and whatever. And the reading were a bit high. And then after a good oral hygiene regime, they checked their blood sugars, and the blood sugars have dropped. So now one of my kind of information I give to the patients, especially those with diabetic, that they should take good care of their oral hygiene, because really it can impact the readings of the sugars because of the blood being contaminated by the germs and bacteria from the mouth connecting into the bloodstream. So it's very important that our people, they take the mouth hygiene as a very important, a daily routine kind of cleaning, so that it can help the other conditions of the body. So connecting anybody, abantu baffe bategeere really the importance of it, to the extent that just to brush is not enough. Or no toothpicks or floss, most of these germs, that's where they microorganism. So most of these conditions really can be worsened by the quality of our mouth. Thank you very much. Or they can get better according to the way we look after our mouth. So
yes, thank you very much. Inshallah. Thank you, sir. Kati doctor katika tuandike your session.
Okay, so really, I try to sit back and see how we can quickly swim through this and make it very easy for everyone to understand this subject. And by the end of the session, I think we should be very comfortable with diabetes, really possible. And before I I start, it's important to note that diabetes, as we talk about diabetes, this is something that can be done by somebody who hasn't had diabetes yet, so that they are able to prevent the diabetes coming. So it can help you in either way if you've gotten diabetes or diabetes. So it can help you either way. So by the end of the day, we should know what diabetes is. We should know the causes of diabetes so that we are able to prevent them. Then what are the symptoms? How do we tell? How does somebody tell that they have got diabetes? And then treatment of diabetes mellitus at the community level. So we shall start with the first one. What is really diabetes? And to really try and make this very simple, I tried to imagine, normally in a person, we have to survive. The body has got, it has all those engines running in there, the brain, heart, the kidneys, the liver, and these machines have got to be fueled. And the body can only get fuel for those machines through supply of oxygen, supply of blood, supply of the different nutrients, and more importantly, glucose. Glucose is like a fuel to the different machines the body has. Just like a car. If you look at a car, the car will need fuel. So the fuel is going to help that car move very well and does to do its function. So similarly in the body requires this glucose to be able to move the different machines so that they're able to work properly. You can imagine your heart pumps blood from the day you are actually before you are born to the day you leave this earth. So that heart has got to have some energy, and that energy by and large is derived from glucose. And so the body, why we eat food is to provide that glucose for the different body parts. And as we eat the food, the body has to break down that food right from the raw material, how it is, into the fiber, in the different components that we eat it in, vegetables or fiber or proteins, or eating a piece of meat, eating a piece of chicken. So the body has got to break to provide the glucose for the fuels. And now, what happens within the body, once the glucose gets into the body, that glucose has got to be either stored in either the liver, or it has got to be utilized by the body. So that process of utilization by the body is totally controlled by insulin. Your food goes into your body. Now that body has got to get into the tissues, either storage or to function. And that small diagram that I put on the side here, okay, so now you can see this is the pancreas. It is really the major organ that produces the insulin. Insulin comes, goes under that, attaches onto the tissues, and then opens up the gates so that glucose is able to enter into the cell. It is either stored or it is going to work as a fuel for the heart, for the liver, for different body processes. That is a very important step for us to understand, because as now we discuss what happens further, we are going to be looking at either things happening at the pancreas level or things that are going to affect our insulin. Now, around what diabetes is, we have, you've heard about people saying that, oh, I have type 1 diabetes, I have type 2 diabetes, I have, I'll start with type 1. Now, when patients get diabetes in type 1, the problem is with the pancreas. Remember, we had mentioned that we have the pancreas, and then we have the tissues where the insulin works. But in type 1, the problem is with production of your insulin, you can see the pancreas has got a problem. Now, at this point, if there are people who are really the health workers, within the pancreas, you can have so many processes happening, so many. You can have somebody either having a cancer of the pancreas. You can have patients who are starved. If you're overstarved, you damage that pancreas. Patients who have got viruses, they can go and damage the pancreas. Patients who have got all these deposits, like if the body has too much iron, it can be deposited in the pancreas. If you have some congenital problems, you may have enzymes that are not producing that insulin very well within the pancreas. And then you could be having some autoimmunity. Now, autoimmunity, that's where the body uses its soldiers and they attack the pancreas. And then the pancreas gets damaged. Now, once we get soldiers of the body attacking the pancreas with type 1 diabetes. The other form I talked about, we've put them under another category, totally another category, which may be a little bit detailed for us. But once for this platform, let us know that for type 1, we really have a problem with the pancreas and it's not giving us the insulin that we require. And most of the time, you will find that these patients, as we are going to see, they will have a difference in the way they present and the characteristics from the ones that have got type 2 that we are going to discuss. Again, just like I said, there's so many sub-classifications in here within the pancreatic damage that we may not want to get into the finer details. So here, really in type 1, no insulin. So without insulin, our glucose stays out. It cannot get into the tissues. So the tissues cannot store that glucose or cannot even utilize that glucose for its functionality. I think there's a slide that I'm not saying. However, at this point, we have type 2. Type 1 is where you have the problem with the pancreas. Type 2 is where the pancreas is producing your insulin, but that insulin is not working well at the tissues. You see this? This is the insulin receptor. Now, the insulin receptor may get problems affecting it, that when the insulin comes, it does not attach very well, so your glucose again does not enter. So by and large, we have many types of diabetes, but type 1, problem with the production of the insulin. Type 2, we have a problem of the insulin working at the receptor. It is being produced very well, but the receptor has got a problem. Normally, this is the biggest majority of patients who have got diabetes. The problem is with the receptor. We don't have the insulin working well. And now these are the patients who will come in obese, because insulin most of the time makes people obese. These people will have adequate insulin within their body, and they will have an issue with their weight. Usually, again, there's so many things that can affect the insulin receptor, but for simplistic purposes, let us just focus that somebody is producing the insulin and it's not working well at the tissues for type 2. Okay, so what are the causes? What are the different things that can put us at risk of developing diabetes? And for starters, on top of our list, you can see we have high blood pressure. Whenever somebody has got high blood pressure, it is a quick trigger to this person that, hey, we need to test your sugars to make sure you don't have diabetes. Because once you have a problem with your heart, then it affects the systems that also control the sugars. And subsequently, you end up with diabetes. We actually say that diabetes and high blood pressure are twins. Once you have the other twin is just around the corner. You're not yet seeing them, but they're just around the corner. So hypertension has got a link with diabetes. Number two, we have the age. Now, as people get old, once somebody goes about 45 years, the body systems start malfunctioning. In a way, your body is starting to close down. So your heart is going to slow down. You're going to have issues with the bones. You're going to have issues with the sight. You're going to start getting issues with the sexual performance. You're going to start getting issues all over the body, including the pancreas. So the pancreas and functionality of the insulin is age dependent. As you get older, you're going to run into issues with diabetes. Sedentary lifestyle. Sedentary lifestyle. This is one of the key factors that has caused us a lot of issues. These days, we don't do exercises. We want to use border. Even when you're going, short distance, you want a border. When you're watching TV at home, you want to sleep. You're using a remote control to control the TV. There's totally lack of any activity. And to make it worse now, we have all the social media, which is also making us more sedentary. So really, the sedentary lifestyle is also giving us a huge increase in the rate of diabetes. Because remember, in the body, once we put in the glucose, the fuel, that fuel has to be burnt. If you don't burn it and you lead a sedentary lifestyle, then you're going to have accumulation of glucose and the systems are going to malfunction. The pancreas. I told you about the different diseases of the pancreas, and those are so many: cancers, gallstones, calcifications, any viruses, any disease that is going to affect your pancreas is directly going to affect your production of your insulin. And of course, some people have got congenital conditions where the enzymes are affected. So really, once you affect the factory for the insulin, you're going to run into diabetes mellitus. Patients who take lots of alcohol is known to be one of the key things that hit your pancreas. Smoking also hits the pancreas. We have so many patients who take herbal medicines all over the place. Those are known to damage the body. And these have also been known to damage the pancreas. Patients who have got other illnesses, cancers, HIV, tumors, also have a risk of pancreatic damage and subsequently running into diabetes mellitus. There's some genetic predisposition with diabetes. I'm sure you've seen families where the whole family, so many people in the family are using insulin. So there is a genetic predisposition. Once you back generations had diabetes, then you run a risk of diabetes. So there you have to stop the exercise and the diet adjustments. And then we have the unhealthy diet. The unhealthy diet. These days we are putting in too many calories way beyond the calories we require in the body. And this ends up storing too much glucose, challenging the body with too much glucose, and then subsequently develop diabetes mellitus. Normally, I tell patients I interact with that diabetes secondary to unhealthy diet is just like sending your child to school. Is in primary. Let's say an example of primary 5. You send them to school and then you give them $1 million as pocket money. That child is the brain is going to look up. That child won't study. They'll just keep doing whatever they want. I mean, they're okay. They have their $1 million with them. So they're going to misbehave. So similarly in the body, once you give the body too much food and too much glucose and too many calories, that body is going to behave the same way. It's going to misbehave. Systems are going to start malfunctioning. And eventually these patients are going to end up with diabetes mellitus. That's why these two, sedentary lifestyle and unhealthy food, are one of the biggest contributors to diabetes mellitus. If there was a way somebody could balance the exercise and the diet, this could push our diabetes way down. So these two are the commonest causes. Then obesity, certainly with the unhealthy diet and the sedentary lifestyle, the outcome there, certainly patients are going to become obese. Once you're obese, remember I told you about the insulin receptor. The insulin is, once you're obese, the receptors for insulin are going to mutate. They sort of like get denatured. They're not designed to have too much glucose. They're not designed to have, the obesity. So the structure changes, and eventually your insulin does not attach, and eventually you get diabetes mellitus. So these three are connected: sedentary lifestyle, unhealthy diet, and obesity. Those three are connected and leading to mutations and changes in the insulin receptor, leading to diabetes. Now, stress is one of the factors that people have not been thinking about. But once you are stressed, the body is going to try and mobilize glucose to help that brain work more, the intestines work more. So in other words, it's going to bring in systems that are going to increase glucose in the body. Once that glucose increases, just like I told you, the body was not designed to have too much glucose. Just like you're giving that child too much pocket money, they eventually lock down. So the body, similarly, you give it too much glucose, is going to shut down. So the stress is going to bring in some inflammatory mediators, some inflammatory systems, some chemicals are going to come in. And these chemicals are going to stimulate too much glucose, and together with the inflammation, they cause damage within the body with subsequent increase in the glucose in the body, which eventually leads you to diabetes mellitus. Of course, stress has other ways it can cause diabetes, because once you're stressed, it affects your morale, it affects your mood for exercises, it affects your ability to eat healthy. You feel like you get into a depressed state if it becomes worse. So really long-term stress, in addition to the increasing in glucose, it also draws back your mood and affects the healthy eating, and affects also the lifestyle. And then, of course, certain medicines. Of course, here I'm calling them medicines, but just like I told you, some people are taking herbs for whatever reason. And these herbs are affecting the pancreas, affecting the insulin receptors, and eventually leading to diabetes. But also, there are some medical drugs like steroids. For example, patients who have got asthma, we use steroids to treat them. We have certain autoimmune conditions where we use steroids. Now, those steroids, by the nature how they work, they push your glucose high in the blood, and eventually you may end up with diabetes. That's why we say if somebody is on steroids, we have to ensure that we use the smallest right dose. So you don't want to underdose them, but also you don't want to overdose them. So you want to use the smallest appropriate dose, so that you avoid the side effects that may come from these drugs. Some people are known to misuse the steroids, say for flu. Again, they predispose them to diabetes. We had so many people who were being treated for COVID, and somehow because of the effects of steroids, eventually they end up with diabetes mellitus. So really any condition that predisposes you to excess steroids in the body will lead to diabetes mellitus. So having seen the causes, eventually what happens in the body? What are the consequences of diabetes mellitus? Why should we get worried about diabetes mellitus? Now, diabetes by and large, what it does to the body, it sort of creates an inflammation. Once your sugars go up in the body, these sugars trigger an inflammatory process, which inflammatory process would damage the lining, the internal lining of your vessels. And because of that, subsequently, you sort of like choke the end organ. This is in the eyes, you get damage to the eyes. If it is happening to the kidneys, you damage the kidneys. If it is happening to the heart, you damage the heart. So through an increase in glucose in blood, we damage the blood vessels. then eventually the blood vessels get blocked, in simple terms. But in medical, we call that atherosclerosis. And in other words, your body starts behaving as though you have got narrowed vessels, and subsequently damaging all the other systems that depend on those vessels. So step number one, we get a rise in sugar levels in the blood. And then step number two, the sugar, because the body was not designed to have high blood sugars. So once we have high sugars, the sugar becomes toxic, particularly to the blood vessels. So the vessels get damaged. Okay, so you get damage to wherever you have a vessel, you get damage. And of course, the body now starts behaving as an elderly. So your body, you are 20 years, but it starts behaving as though you're 30 years. So you start getting features now, which would have occurred 10 to 15 years away. And of course, subsequently, you get dysfunction of the different systems. Diabetes mellitus, by and large, is a vessel disease. It damages vessels. And as we know that every part of the body has got a blood supply, we have blood all over the body, the brain, the heart. So you get dysfunction of the different systems in the body. Again, this is to throw more light to the consequences. Diabetes is one of the diseases that hits most of the systems. It is a multi-systemic disease because it virtually damages every part. In the brain and nerves, I'm sure as we are going to see subsequently, you're going to see the damage it creates within the brain. But these patients will come in with features, things like stroke, things like burning of the feet because of nerve effects. The nerves are complaining that we are not getting enough supply. And to make it worse, because now you're cutting off the vessels, the tissues are going to start dying. And as they die, they start complaining. And for the nerves, you will get pins and needles. You get pins, you feel your hands, you get those pins, and in the feet, you get pins. And then in the eyes, these patients will start getting blurring of vision. So because of effect in the eyes, as we are going to see, and then the kidneys, the heart, the liver, reproductive system, the skin, limbs, and muscles. Dr. Sugd, I'm sure, is going to be very happy. I managed to remember the mouth. The mouth in there is some people forget about the mouth, but the mouth is key in these patients. The whole intestinal tract can get affected by diabetes. And then some people also forget the immune system. It affects the immune system together with the blood itself. Majority of our patients who have got diabetes are also anemic because diabetes affects the blood as well. So you can see from this that diabetes is a multi-system disease. It hits every part of the body. So how are we going to detect diabetes? How shall we tell that we have diabetes here? Now here I try to show to really show some of the symptoms that patients may come up with, and this is part of the things they'll come with, but the list is so huge. Just like you saw that the organs are affected as so many. So virtually patients will come with defects from any of those systems affecting them. But the other list I try to put up is just like a brief to show us what exactly these patients may come up with. So for starters, one of the key features these patients are going to get, they're going to feel hungry. Remember I told you that the insulin is supposed to be taken up into the cells to be used by the body. Now the body cannot use the glucose. Your glucose comes into the body, but the body cannot use it because you don't have insulin. So you're going to feel hungry all the time, okay? And then because of this hunger, this patient, because of lack of use of the insulin, these guys are going to keep eating, and now they'll even become more, the sugar levels will increase even more. Number two, they become thirsty. And this thirst is because once the blood sugar levels go up in your blood, the body tries to eliminate this glucose. So you end up passing glucose in the urine, and as you pass that glucose in urine, subsequently you become thirsty because the glucose goes with water. And you can sit down here, we have urination. So as you urinate, you're passing out that glucose, it goes with water, eventually become thirsty. Now, on the other hand, these patients also gain more weight. Remember I told you, as these patients have, especially the type 2s, because of the high insulin levels, they gain more weight, and also because they eat a lot. So because of the diet, now the weight becomes even more. However, if somebody has got type 1 diabetes, or if somebody has got something affecting the pancreas, they don't produce insulin, we said. So those patients may actually lose weight, they become thin, because this is majorly because they don't have insulin. Remember, insulin is supposed to help you put on weight. You don't have insulin, the weight goes down. Eventually, we said that these patients, high blood pressure is twin to diabetes, so they end up with high blood pressure. I talked about the nerves. The nerves start complaining in the feet, in the hands, because they're not getting the supplies. You're cutting off blood that is going to the nerves, so they start complaining. Again, the brain has got an effect, so these patients start getting dizzy because of the loss of water. The glucose, as you urinate it out, so they become dizzy, and it keeps into a cycle. And then, of course, the sugar within the blood keeps going up because now the body thinks, oh, I'm not having enough glucose in my for the body to utilize. So it pushes even more glucose into the systems. And then people tend to forget about the sexual disorder. The sexuality gets affected. I want to take some time and emphasize this point that especially patients who have got diabetes, if it is poorly controlled, then they run into an issue of reproductive system runs into problems. So for the men, it may be hard to get an erection or sustain it. For the ladies, the lubrication and the desire and the libido may go down. So really, we get an effect in the sexuality. I've already mentioned about the urine. We keep passing too much urine out because the body is trying to control this glucose. As it goes out, it goes with water. And then the eyes, we said the eyes is one area that can get damaged by the diabetes. So these patients may come in with problems in seeing. And then candidiasis. Remember I told you about the immune system? Because the immune system is usually an area that is affected, these patients eventually get candida. Candida is like an opportunistic infection. At times when the defense is down, then comes in. But also, candida is an infection that feeds on glucose. So once you have the glucose levels up, it will come to try and feed on the sugars. And many other infections, skin, UTIs, gastrointestinal infections, because the immune system will have an effect, a problem. So really that is just a summary, but to take you back to this list, you can see that the list is so huge. So patients may come in with any of effects in these systems as an indicator that you may have diabetes. This list just shows you the common features that you may get. But at this point, let me try and emphasize that diabetes may be silent. You may not have any of these features, yet you've got diabetes mellitus. So how are we going to detect diabetes mellitus? Okay, we say diabetes most times is silent. By the time you start seeing symptoms, it is actually starting to damage your things. So Remember that. So you should be checking your sugars on a regular basis. Whenever you check diabetes once you're in hospital for any other illness, you've gone for pregnancy, you've gone for a cough, you've gone for any other illness to hospital, we have to check diabetes at any opportunity we get. And then before any procedure, you may go to Dr. Nsubuga, you want some dental care, you may want the sugar checked. That is an opportunity for you to have the sugars checked. Because if you don't check the sugars, the wound healing is going to be very poor. Our outcome for the procedure is going to be very poor. So let's use that opportunity to check the blood sugar. And then systems evaluation, especially if diagnosed with diabetes. Really, I put in this slide to remind ourselves that for those who take care of these patients or those who have got the diabetes, they should all the time try to, in addition to checking diabetes, to check the other systems to ensure that they are not damaged. The eyes, the heart, the liver, the kidneys, to ensure periodically, at worst, check them once a year, at worst, but preferably every 6 months. Important message here, diabetes is always silent. Let's look for it actively. Okay, this is now, if you have tested your sugar, how are you going to tell that, yes, I have got diabetes? We use 3 different methods. We can use the fasting blood sugar, HbA1c, or oral glucose tolerance test. And for fasting blood sugar, if you go above 126, and normally we may want you to do it more than once, then you have diabetes. HbA1c, if it is above 6.5%, on 2 occasions, again, we think you have diabetes. Then oral glucose tolerance test, if you go above 200, and then we think you have diabetes mellitus. At times, we may even use 2 parameters. For example, you can use the fasting sugar together with HbA1c, or HbA1c together with a oral glucose tolerance test. Remember, we can also use the random blood sugar. And the random blood sugar, if you're going to use it, if you go above 200 milligrams per deciliter in a random blood sugar. If I say random, means you just walk into the hospital and they test your sugar, a spot sugar check. Then if you go above 200 milligrams per deciliter, plus symptoms of diabetes, plus symptoms, polyuria, you're passing too much urine, you're eating a lot. Basically, you have features that suggest diabetes, but in addition, you have a random sugar above 200 milligrams per deciliter. Then we can use the random blood sugar. But otherwise, the fasting sugar is normally 8 hours without you eating anything. That's why if you go above 126, that's when we say you're diabetic. This is something very important that I also wanted us to discuss, that not everybody will drop into the normal and the abnormal side. We have patients who are in between. You can see here, diabetes, these are normal. See, we can do that for fasting blood sugar. We can do that for oral tolerance test. And those are the different figures. But this category of patients, the pre-diabetes, are a group which is in there. They are not normal and they are not diabetic. However, there is damage going on within their body. The eyes are getting damaged, the nerves are getting damaged, the heart, the liver, the intestines, the teeth are getting damaged before they drop into the overt diabetes. So this group, we should. So how are we going to treat and prevent this diabetes mellitus, having seen how to detect it? So number one, we are going to look into the diet, and then we shall see the exercise, we shall see the weight control, we shall see the stress, we shall see also the medicines. Plus, of course, the social support. So these are the different areas that we are going to take time and try and see what happens in each of those. You can see here, I put for you the diet, that is the input, what you're putting into the body, and then the exercise, that is the output. These two have got to balance. You must have a balance between what you're putting in, what is coming out. Otherwise, your balance sheet will not balance. And then the weight is an indicator how you're performing. If you're doing the diet and exercise, the weight control is a quick indicator to you that, hey, you're on track. And of course, we shall discuss stress medicines and also the social support, which are very important for us, either in terms of prevention, if you don't have the diabetes, or primary prevention for those who don't have the diabetes, or secondary prevention who have diabetes, and we want to minimize damage, as you have seen, to our organs, and also for treatment. Okay, so diet. Just like we said, diet is really the input. If you have diabetes, or if you don't have diabetes, please do not give this child too much money. Keep that in mind. Do not give this child too much money. That is our diet, our input. Do not give the body too much glucose. Do not give it beyond what it wants. If you give it beyond what it wants, it's going to store it. It's going to cause problems in the body because our body was not designed to have too much of that glucose. It is always important to remember that, having said that the body requires calories. The calories are going to help our different organs move, our different systems to move, the heart, the liver to function. They need calories, and those calories come from the diet. And the major sources of these calories are carbohydrates, fat, and proteins. Those are the key sources. However, fats and proteins will give a rise in calories, but little change in sugar levels. Now, this is a key message, very important message, that fats and proteins will give you calories. It will help move your systems. They will run. The beauty with them, they don't cause a change in sugar levels. On the other side, the carbohydrates will give you the calories as well, but they give you calories and also cause a rise in blood sugar. In a patient with diabetes, or even a patient who is non-diabetic, a normal person who is trying to avoid diabetes, you want to, as much as possible, to run away from the too much carbohydrates, because they're the guys who cause havoc. They're doing two things. They're giving us calories, but also causing an issue with sugars. So if I eat a piece of meat, that would mean that that piece of meat will give me calories. I'll feel okay. I'll keep seeing my patients. I'll keep working, but my sugar levels will not go up, but my machines will keep running. So it gives you the energy, but it doesn't give you sugar changes in the blood. Of course, that part has a little bit of detail that maybe for another day. So it's important also to note that in a day, an average person will require 2,000 calories per day. That's a normal person, around 2,000. And of course, there are variations in there depending on your weight, depending on the activities, depending on the nature of your lifestyle. You may have other illnesses, but this is really to give us an arbitrary starting point, 2,000 calories per day. Okay, and it's important also to note, these are key things that I give you that are going to be important in the talk we are going to have subsequently. 1 gram of protein will give you 4 calories, and then 1 gram of carbohydrates will give you 4 calories as well. But your fats are so notorious. 1 gram is going to give you 9 calories. Now, having said this, remember what I said, that these fats and proteins don't cause a rise in sugar. However, what they do, they give you too many calories. If you take plenty of them, they'll give you too many calories. So you have to ensure that even when you're using the proteins and fat, you keep within the accepted caloric bracket, the 2,000. If you go beyond that, again, you'll become obese. Then subsequently, you'll affect again the insulin function, and subsequently you worsen your diabetes, or you'll end up in diabetes. Again, with diet, this is really just to give you an indicator how to, again, the carbohydrates form 65%, which is around 300 grams. Of the 2,000 calories you need per day, the carbohydrates provide you with on average, 65%. This is in a normal person. Remember, normal person. And then for the proteins, 25%, which is around 50 grams per day. And then the fats around 20%, which is 60 grams per day. However, if a patient has got diabetes, If a patient is targeting to lose weight, then we cut back on the calories. We starve the body a little bit. We drop back on how much we are putting in. We drop to 500 to 1,000 calories per day. Some literature, of course, if you do this, this will give you a big drop. But if you do somewhere 1,500 per day, then that will give you, on average, a loss of 0.5 kilograms per week. But of course, this is also dependent on the exercises, the other activities, your body mass, and things like that. But this is really an average. So, how are we going to determine the 2,000 calories? How do we, doctor, how are we going to take the 2,000? So what is the objective of the meal plan? So for us to know how much we are going to take in, we come up with something we call a meal plan. You plan, what are you going to eat to give you the 2,000 or to give you the 1,500 for those who want to control diabetes or who want to lose weight. So for starters, we must have, why are we doing a meal plan? Number one is that, remember that the body requires these nutrients. So while we do a plan, you must take in the macro and the micronutrients. The macro are the big foodstuffs, carbohydrates, proteins, and fat. The micro, that's where we have things like magnesium, zinc, vitamin B12, vitamin 6, the different vitamins and nutrients the body is going to need. Those ones drop under the micro. They're also important, they're required in small amounts, but very important for the body functionality. For example, if somebody has got a drop in vitamin D levels in the body, the immune system is going to be affected. They're going to be predisposed to diabetes mellitus. Then calories for systems plus repair. Remember, we said we need the calories, and then without causing a rise in blood sugar. So our objective, we want to get the nutrients. We want to get the calories. However, we don't want that rise in sugar. Let's keep this at the back of our mind. And then this plan will vary from person to person, but what is key, it has got to be balanced. Okay, so again, with a meal plan, the meal plan will involve so many things, but it should involve what is your target. Do you want to lose weight? Do you want to gain weight? Do you want to control diabetes? Do you want to stay healthy? So you have to lay that plan well in time. What is your goal? And then your tests. Okay, some people have got a test, maybe they prefer certain foods. For example, in Uganda, certain regions, they eat Irish potatoes, other regions, they eat other foodstuffs. So really you want to put in the test and the norms and the customs in there. And then the lifestyle. Some people have got different lifestyles. For example, some people are going to have a big meal at lunch. Some people have a major meal at supper. So really you have to factor in, what is this person's lifestyle? A person who is going to work night duty probably is not going to eat at their work. Then the activities. What activities does this person, what are they involved in? Are they doing hard work? Are they, what is the activity like? And then the medicines, of course, that they are taking. So how do you align the different foods with the medicines, and of course, the different illnesses. We have patients who may have other illnesses, so those have got to be also factored in and tailored towards this plan. Okay, again, with our plan, sorry, we have again, with the meal plan, we have three major ways how to determine how much to eat. We need our 2,000 or 1,500, but we have to determine how am I going to do this? So number one, we can use what we call the plate method. Number two, we can use the portion sizing. And then number three, we're going to see the carbohydrate counting, how you count the carbohydrates. Remember, I told you the carbohydrates are the ones that are really notorious. So you do what we call the carb counting. So number one, let's do the meal plan, and particularly we're looking at the plate. Remember, we are looking at the diet, but now we're asking ourselves a question: how are we going to determine how much to eat? So number one is we use the meal plan. And you can see the meal plan on this side. You can see that this is our plate, and particularly this is supposed to be a 9-inch plate, which doesn't have that much depression in it. And you see 50% of this food is going to be vegetables, 25% is going to be your carbohydrates, and then your 25% is going to be your proteins. Okay, so 9-inch plate, vegetables 50%, protein 25%, carbohydrates 25%. That is a quick, arbitrary way of determining how much you're going to eat. And of course, you can always keep varying this depending on how you see your weight, how are your sugars vary. And then we go to number 2, which is the portion sizing. You're sizing out your portions. And this is, say, a particular meal that you're going to have. So you can see that the vegetables on one side, the vegetables are right there. So the vegetables are going to form like a fist, okay? So one fist will form your vegetables, and then the carbohydrates, you're going to use a scooped handful. That is a scooped handful right there. And then proteins, where we have the meats, is going to be a palmful. And then at times you may have the spreads, the things like the fats, and okay, then there you use the thumb. So one thumb for the fat, particularly the spreads and things like that. So again, this is another quick, arbitrary way of again designing your plate. Remember, it is a 9-inch plate. Okay, and then we come now down to the real numbers. This is a little bit complicated and detailed. If we come to the carbohydrate counting, the carbs, we call it the carbs counting. And normally here you're following the food labels. Most of the foods have labels that you go ahead to observe. And from here you can see, for example, step number 1. You get your food that you're going to take, which is normally there. And so in one serving, keep in mind that package often contain more than one serving. This example shows that the package contains 8 servings, but the information provided is only for 1 serving. So you can see here, the label clearly shows you that 8 servings per container. That's the total servings that you'll get. But 1 serving will give you 2/3 of a cup. And a cup normally is around 250 mils. So that's almost like 55 grams. Now this is like what 1 serving will contain. And then look at the amount of fat, especially saturated and trans fats in each serving. So you want to minimize this section of fats. So if you're debating between different foodstuffs, you may want to go for one with less fats, because these ones are going to cause damage to the vessels, yet the vessels are already being damaged. And then see how many grams of carbohydrates are in each serving. And here you can see that the total, you have 37 grams per serving. So remember, we're also calculating how many carbohydrates you're going to take. So from here, you can see you already have 37 grams in a single serving. You can also see how many grams of added sugar the food contains. This sugar that has been added as a food is meant. Try to choose foods with less added sugars. So you can see here, if you see down here, we have includes 10 grams of added sugars. These added sugars are really refined, so they are going to cause an abnormal rise in your sugar levels. So you want to minimize foods with added sugars, and then decide whether the food is fits into your plan. So really, this is where you go ahead and look at that particular carbohydrate, see how many grams they are, and all from there you're able to determine how many you want per day, how many servings of that particular food you're going to take. Of course, considering how many calories that you're going to get. Now, this is the calorie per serving. So in other words, if you take 1 serving, which is 2/3 of a cup from this particular meal, you'll get 230 calories. But the carbohydrates will contribute 37 grams. Again, I put in some examples that we can look at. Again, here, this is at the top of the label and generally provides a measured amount as well as the weight. So a serve is 2/3 of a cup and it weighs so much, but the whole container has 8 servings. And these are the total calories per serving. And they also indicate how many are coming from fats. You want to minimize the ones that come from fats. And then when you look at the carbohydrates, you can know how many carbohydrates that are in there, how many grams they are, and you're able to compute based on how many carbohydrates you want to have per day. Okay, again, these are other examples. Now, it is always important to remember that whenever you're doing carbohydrate counting, for example, here, you have carbohydrates which are 40 grams, you have to subtract off the fiber, because the fiber is, by and large, is not calculated within the carbs that we are counting. So here you do 40 minus your 4 grams, then you get 36. So 36 grams will be your net carbs from this particular food label. Okay, so now we go to weight control. Weight control, I try to put down a number of aspects within the weight control. BMI, the body mass index, that is going to be the key parameter you're going to use. You use your kilogram in kilos, your weight in kilograms, your weight in kilograms, divided by your height in meters. And our target is for you to be between 18.5 and 24.9. That is your target. This is a normal person. Above that, you're going into danger. If you go above 25, if you're below 18.5, then again you're wasted. Now, over time, they realize that only using BMI may not be enough, because some people may have variabilities in any of these. Some people are really tall, and it may affect, it wasn't a very good measure. So they added in what we call the waist hip circumference. And this is where you measure your waist. The waist has got to be measured from the smallest spot within your waist, and then the hip is measured from the widest spot within the hips. So for male, it should be less than 0.5, and for ladies, it should be less than 0.85 for a normal person. So you want to keep below these cutoffs. But of course, in there we have the waist circumference and hip circumference. But waist hip circumference is the best, because it takes into consideration the waist and hip. Okay, we cannot do diet without talking about, weight without talking about the keto diet. And really this comes in weight control. Many people have tried to control their weights here and there. And so the keto diet, I'm sure you've heard about keto diet here and there. So what essentially this does is it is helping you control diabetes or prevent diabetes, or to ensure that your sugars are controlled. And all you're doing is that you are now using other sources of energy other than the carbs. So you want little change within the glucose. So you want calories, a source of energy, but without a change in your blood sugar levels. And essentially here, what you do, the carbohydrates are pushed down. Remember, the carbohydrates are 25. Now we push them lower to 5 to 10. Even some people do none at all here. And then proteins are down to 20 to 25, and then the fats go up 70 to 80%. So really, in the keto diet, all you're doing is that you're pushing less of the carbohydrates and having more of the proteins and the fats. Okay, and here we go to, again, weight control. I'm sure many of you have heard about fasting as a model to control weight and also control our sugars and improve functionality of the body. And you've heard about the intermittent fasting, where within the day, you have a window of 8 hours only. Within those 8 hours, that's when you can have something to eat. After those 8 hours, you fast for the remaining 16 hours. So that's what they call 16/8. So you can do that on a daily basis. So for 8 hours, you could eat something, you could drink something, then the remaining 16 hours, you don't take anything. And then there's a model, what they call the 5 to 2 diet, where these people are fasting 2 days a week. And this wasn't based on anything and this is based on research. And they discovered that actually when people eat, for example, day 1, skip fast on the white one, they're fasting, then day 3, day 4, they're eating, then day 5, they're fasting, then day 6, day 7, they're eating. And they discovered that this actually also help control weight and also minimize the rise in the sugars and control obesity. So that is what we call here 2 days a week. of fasting. So you get 2 days, and on those days you don't fast. Or some people, what they do on those days, they take minimal calories, like 500 calories. So you're only taking like 30% of your required calories, or complete fasting. So you can see if this day 2 is a Monday. So Tuesday, Wednesday, you fast Thursday, Friday, Saturday, and then day 1 is Sunday. So you can see that this drops within what ordinarily a Muslim should be doing if they can, fasting Monday and Thursday. And then some people, of course, they kept alternating it. Some people have done what they call alternate day fasting. They eat one day, fast one day, eat one day, fast one day. Also, that controls the diet, the weight extensively, and also control the sugars to a great extent. Studies have been done to look into 3 days a month, where people have again selected 3 days a month where they fast, and that has been shown to improve the weight, improve functionality of the systems, and also control sugars. Of course, in the intermittent up there has been some modifications. Some people have reduced these 8 hours of eating to a minimum of, like, say, 4 hours, where you only have 4 hours gap where you eat, and then the rest of the 20 hours you don't eat. But all those are within the context of fasting. Again, we can't mention fasting without mentioning something about Ramadan. And again, Allah, if you have diabetes, certainly Allah allowed you not to fast, but some people really want to fast. If you fast, then you have to ensure certain things. You have to change your medications. You have to frequently monitor the blood sugars. You have to have a thorough meal plan, which you have to do way before the Ramadan starts. Your exercises have got to be tailored into remembering that within the day you're not going to be eating anything, and then how to recognize the danger signs. It's important to know when the sugar goes up or goes down, and then issues to do with breaking fast and so forth. So really for Ramadan, somebody has got to factor in the different dynamics, and normally the patients, I tell them, try out this before Ramadan starts, so you're able to tell how your body behaves when you
Doctor must be frozen.
It breaks down fat because the body doesn't have glucose, so it's going to end up breaking down fat. And then weight control, it helps us weight control, and of course better functionality of the preventing it. We really need exercises, but these you have to create a very organized exercise plan, just like the diet. But they are better in the morning. Your target is 150 minutes of exercises per week. And these ones, you can break them up. You can say, I'm going to do 50 minutes on 3 days a week. Or you can say, I'm going to do 25 minutes for 6 days. Or some people could do. So you break it up into different days. You don't have to do 150 in a single day, no. The bare minimum, you want to split it up within 3 different days. So on average, normally what I tell patients is that you can do 20 to 25 minutes per day. Or there are certain apps that can guide you on these. The people who use the steps on the smartwatches, those can help you calculate the steps. If you do 10,000 steps per day, that is really, really heavy. Few patients can able to do 10 steps per day unless you actually do the exercises. And then, of course, this shows you the different exercises you can do. And really, these you have to know your body. If you have arthritis and you have all these pains in the bones, you're not going to go running. If you have cardiac issues, you're not going to do aggressive running. If you're an elderly person, you're not going to do heavy weights, okay? Trying to do the isotonic exercises. But really, this is to show you the different exercises that you're going to do. What is important? Personalize, individualize those exercises, and then ensure consistency with those exercises, and then factor in the different, your activity, your other illnesses that you have. For example, if somebody has got asthma, you don't want to go running when it is cold out there. So you may want to say, do some running indoor when you're inside your house. But you can go swimming, you can skip a rope, you can, you can go hiking. People have told me that yoga is an exercise. I'm not an expert at yoga, but people have said yoga is an exercise. I'm yet to be convinced, but it is categorized under exercises. And then so many exercises, as long as you're burning down calories and in an organized, planned way. It has got to be organized and planned. For example, I could go to my garden and I dig. If that digging, I'm burning down calories, very good. But it will be also nice to combine what we call isotonic to the isometric. You want to do some involvement of different body tissues. And you also want to sort of like cover distance, like running or skipping a rope, or riding a bicycle, things like that. Remember, we talked about stress and the body and diabetes, because once stress is not well managed, it really, really affects the body. What happens when you're stressed? The body releases inflammatory mediators that go ahead and cause a rise in sugar in the body, just like I told you. Eventually, also the stress affects your lifestyle, your exercise, your diet. You lose the morale and the mood, and eventually it affects the different systems. So really this, I try to put down things that you can do to try and put off that stress. When you exercise, you knock down the stress, go visit family and friends, reduces stress. Sleeping is very important. You have to sleep at least 7 to 8 hours per day. There are some relaxation techniques. The yoga is going to help you there. Okay, and then and so on and so forth. All these are different parameters that I put in there that you'll find time and look at that can help you reduce stress. Certainly reading the Quran also helps in relieving stress. Okay, the medicines, of course, I didn't want to go into those. These are really technical, but it's important to note that we have the tablets, we have the insulin, and it's important for you to note that the insulins have been modified now. We have the automated systems, which systems can automatically test your sugars, and then also some can test the sugar and also deliver insulin. And now we also have things to do with the pancreatic transplants. They have tried out the stem cells for the pancreas, and science is really developing in the area of therapeutics. I didn't want to go too much detail into the therapeutics because majority of our audience are probably patients who are trying to prevent diabetes to occur. But for those who may want this into details, you can always inbox me, and then we can always discuss the medicines and the insulins and how to go around those. Okay, what is very important for us to take home, just before I forget, to note about the medicines. The medicines have got to be tailored together with the other medicines that this person is taking. Somebody may be taking medicines for other conditions, and some of these may interact with the diabetes medicines, just like we mentioned the steroids. What is important take-home message for us? Sorry. Important take-home message for us to note is that diabetes mellitus is preventable. It is one condition that we can prevent. It is one condition that we can early detect. If we do routine testing, we can avoid it by trying to lead a healthy lifestyle through regular exercises, healthy meals. And then for those who are diseased, once you do the healthy lifestyle plus regular, be consistent on your medication, it is something that is controlled. Of course, people come up with questions like, can diabetes go? Now, what I can say is that with diabetes, you are able to go off medicines. If you are consistent with a healthy lifestyle and diet, you can totally go off medicines. However, if you revert back to the unhealthy styles, diabetes will come back. So if you have diabetes, you can go off medicines, but it will be silent within your body. ready to bounce back. So you don't want it to bounce back. Once you start the weight control, the exercises, the healthy lifestyles, it's important to maintain that so that you don't get a relapse of diabetes mellitus. Before I also forget, certain people somewhere, alcohol and smoking are no-go areas at all for patients with diabetes, or even in normal persons, because they cause damage not only to the pancreas but to all other systems within the body. So alcohol and smoking are totally no-go areas. Previous studies had suggested that small volumes of alcohol could help the body. No doubt, alcohol, just like Allah told us that it has some benefit, but the side effects from the alcohol are far more than the benefit is going to give you. It's going to cause damage to almost all systems. Actually, alcohol is far more dangerous than even diabetes itself. It will damage virtually every part of your body. Smoking is even worse. Otherwise, thank you very much. Questions, comments, supplements are very welcome.
Barakallahu fikum, Doctor, for the wonderful presentation. Very simple, very well explained. Alhamdulillah. Tukwebaza for sharing all that knowledge you had for us. There's a lot to learn every day. And I'm pretty sure most of all of us have had something new to learn today. Anybody who has any questions, you know the drill. You raise your hand up, then Dr. Swolokudame will also, inshallah. Sister Nilfa, if you have anything to add on or any question.
Not really. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Doctor, for that. Very, very much. I really liked the topic. I really liked the one of the diet, because that is, I think, what is actually disturbing most of my family members who are diabetic. We struggle with telling them about the diet. They insist on this. I want to do this. It's really hard, very, very hard. But it's been very interesting anyway. Thank you very much. The issue that I had wanted Doctor to point on was about, we're having a problem now of people relying on herbal medicines instead of taking what the doctors have actually prescribed them. Especially the anti-diabetic medication, like the metformins and stuff like that. They don't want to take the insulin. They believe that their herbal medicines are the ones going to work. And we're actually having a problem with that, with people now. And the other issue is also people getting tested. The other issue is also the one of people getting themselves tested. I know it is a very issue in Kampala. Simanche tugenda kola bantu baffe tebagala genda w'abasawo. Naye abamu bagamba sente mulinyisa nnyo akabeeyi. Tubasaba abasawo. We have to do a lot of health promotion regarding diabetes in Uganda. Abasawo, Mr. Edrisa nkwegayiridde, oba mukole some kind of workshops. I'm ready to come back and we do this and sensitize people. Naye abantu bagamba akabeeyi, nze Mange is one of them. Nze sigenda genda kulaba musawo every 3 months. She's been on insulin, God knows for how long. Naye nze sigenda genda kunkebera, omugamba balina okukebera mami. Because sometimes the dagairim bari kujja kutayagala esente mubaseera. That is an issue actually, and yet I've realized sukari aruma abantu e Uganda asse bangi. That's what I'm saying.
Thank you very much, Nilfa. And it's a pleasure to meet you again. Now, it is very important. Number one, let me emphasize this, that the public has a misconception that the modern medicines stand alone. No, the modern medicines are actually developed from herbs. One time I got a chance to visit Max Serono, the factory, and they have a whole block, a whole complex block for herbals. They have a herbal line. But all they do is to study these herbs to see which drug is active, and then they run with that. Now, the herbalists, what they do, they run on misguiding the public that the herbals will work, the modern medicines are not working. But by and large, it's just misleading our people, and the herbs they're using, they're not studied in terms of the benefit they're going to do. They're not studied in terms of the side effects they're going to do. Yet the modern medicines have been studied in terms of their efficacy, they've been studied in terms of the side effects. And most of the patients actually come. Just like today, I received some patients who got damaged because of herbals. Some person has been taking herbs for a long time, eventually they end up with damage in their organs. So it's very, very, very important that the public should know, our relatives should know, that the herbals, it's not that they don't work, but they're not studied. They need to be evaluated. And I'm not saying they don't work. Some of them have got, just like I told you, they develop medicines from the herbs. But the person giving them to you has not studied anything. They don't know how much to give you, what effects is going to cause to the body, how are they going to detect that there is actually an effect to the body. So what is important for them is, and actually in my country, there's a team we put forward to try and help to liaise between the herbalists and the modern guys. But some of the herbalists don't want to come up because they know, and some of them, even once they get the metformin, the Forxigas, the modern medicines, and then they pour them into their herbs, and then they confuse the public even further. So really, herbs are a no-go area until somebody has done good work on them.
Doctor, sometimes there's a conception, or maybe it's a misconception. When you take something bitter like aloe vera and stuff like that, ebikawa is good for treating diabetes. So that is why they kind of know, on top of not having enough money to be able to go to the doctors. Magama kastonyo kubikawa, liya kubi greens nyo kwa aloe vera, echigaji, chiyamba nyo kusukali. They don't have machines for testing. So sometimes they end up resulting to taking the herbal medicine because it is the easy way out.
Now, I think what is key now to note is that at my center at Wellington, Buganda Road, if somebody comes in and they actually cannot afford, we don't stop treating them. We treat them because we do have a community support component. You certainly cannot leave somebody because they cannot afford. Once they come, we can always treat them. That's number one. Number two is that now glucometers, the cost has gone down, really, really down. There's a program that has started that is giving out free glucometers as long as somebody is able to buy the strips. A single strip will cost them maybe like 2,000. And if they can't afford the 2,000, then it's sad.
2,000 per tin of strips or 2,000 per strip?
For a single strip.
Ooh.
For a single strip, 2,000 to test. Of course, if you come to hospital and you don't have your meter, I'll factor in that you've come to me, so I'll cost you at say 5,000. I'll add in a markup for myself. But otherwise, a single strip will cost you one stick, 2,000. And the meters of recent, they have started giving them out free. And the other thing, they're running away from this cost and running into a bigger problem. And running into a bigger problem that will cause them far more issues. So that would be my quick take. But however, Milfa also mentioned about the herbs. These herbs are actually dangerous to our people. We should advise them not to take herbs. And then the cost, I've mentioned that. Okay, I think somebody raised a hand in the chat.
Yes, Sister Janet Jingo.
Assalamu alaikum. Thank you very much. Thank you so much, Dr. Mutebi, for this informative session. And I just wanted to ask two questions. One of them is about cholesterol. Is there a relationship between diabetes and cholesterol? Because for one, the East African diet is so much carbohydrate intensive, if I may say that. But then if you have cholesterol, then, if you limit your carbohydrates, for instance, in order to avoid diabetes, then that means you might have to go into things like meats and, things like that. I don't know whether there is a relationship between diabetes and then the cholesterol. And also, this would be my second question, that if you have juvenile diabetes, for instance, for a kid, do you increase, because children are really still growing up and they need this balanced diet? So how would you balance a child growing up with potential juvenile diabetes? Do you limit the carbohydrates and then how do you balance that diet for them so that they don't, they are still growing and I guess they need everything? How do you balance that for a juvenile diabetic kid? I hope,
okay.
Yes.
Thank you very much. Was that Janat?
Yes, this is Janat.
Okay. Thank you very much, Janat. Now we know. I will start with the last one, the juveniles. The juveniles is a very delicate group to treat in terms of diabetes. Number one, they are growing just like you said, so we have to ensure that we factor that into play. Number two, they are active. They're running. They're doing all sorts of activities. So what we should ensure is that for their growth, mainly they require proteins.
Yeah.
So really, for them, we need the proteins. However, because they're active and running about and doing all these sorts of things, we want to push in the carbohydrates. But remember, I told you, the carbohydrates are tailored towards your activities as well. So these guys are running a lot. A child is running a lot, very active. Then you may want to adjust that to carbohydrates slightly higher. Remember the plate formula that we said, the 25 for protein, 25 for fats, and then the vegetables. You may want to increase a little bit on the carbohydrates because those children are active. And having said that, all that is done in line with repeated measures. In children, you actually need more measurements because one, they run a risk of going into hypoglycemia, and their sort of dynamics are different from the adults. So in children, you may want to do more measurements during as you care for them. I think we may need a special session to go into proper treatment or management for diabetes per se, for people with diabetes, not looking into the preventing arm, but now the second of the people who have got diabetes. But children, you have to do frequent measurements, adjust the protein, the carbohydrates a little bit. They need plenty of proteins because they are still growing up. And then number two, you asked about the cholesterol. Cholesterol, just like we said, cholesterol is an area that we try as much as possible to avoid, because cholesterol, that's okay if it's going to give you some energy without a rise in your sugars, but it is going to cause damage to the blood vessels, giving you diabetes. Is going to further affect the insulin action in the tissues, worsening your diabetes at the same time. So it will cause you some other issues related to diabetes, because remember, that is a third cousin. Cholesterol, diabetes, and hypertension those are triplets. So cholesterol, we should try and avoid the triplet, the cholesterol. If we're eating our meat, let's try to take the lean meat and try to also roast it to ensure that we burn away the fats as much as possible.
Thank you very much, Doctor.
That's about it, Doctor. Chairman Mami Subuga, you have the mic.
Assalamu alaikum wa rahmatullahi wa barakatuh again.
Alaikum salam wa rahmatullahi wa barakatuh.
You excuse me, I was having patients in between, so I've maybe missed some of the discussion, but I think the recording
I mentioned the oral cavity.
All right. That's good. That's good. That's good. No, it's very important that we try to connect the whole body. You know, whatever happens in the other side may affect the other parts of the body. Yes. Anyway, I was hearing about the carbs and the proteins and whatever. To be more specific within our food culture, you know, the matoke, the cassava, the remonde. So if someone wants to increase the protein, I mean, I know it can be the meat and fish and whatever, but within our food culture as a Ugandan, origin person, what kind of food specifically are we talking about?
Now, diet, just like we said, that is an area that yes, please.
If I may also add on to that, what Mami Subga has said, Kati, the diets, most people in Uganda or a regular person is not going to look at the labels, the food labels, to know what the calorie content is, the fiber content, the amount of sugar. They'll just go again. I'm Katali, afune lumonde we, afune toke, atekeka kumuogo, ateko nechi janjalo. You know, stuff like that. They don't measure. They don't have the knowledge of actually like even reading labels. And not only that, not only in Uganda, Kubanga, even like some of us in the diaspora, sometimes we don't look at those labels to read and say, okay, what should I eat? What should I not eat? So what advice do you give us?
Okay, thank you very much. Now, diet is a very delicate area, extremely delicate. Now, that's why I presented three forms. We can either use the plate method, we can use the portion sizing, or we can even use the carbs counting. All those methods are really they are very hard to follow. Now, I'll give you a quick one that I normally give to my patients, and totally that has been designed by me. That somebody could decide to follow it or not, but it is based on how much you require per day in terms of calories. And patients who come to me, I tell them, fine, we need our major source of calories is going to be carbohydrates. Okay. Now, the carbohydrates, I tell them, let us use 150 grams of carbohydrates a meal, and we do that 3 times a day. We use the scale. You see the scale we use in the kitchen? That is what they use, the one that measures in grams. So they measure 150 carbohydrates in the morning, 150 lunch, 150 evening for carbohydrates. Now that will give you a total of close to 500 around there of carbohydrates per day. If you remember how much the carbohydrates are supposed to give you, it is close to around 300. Now, the rest of the things, remember, they don't affect that much your sugar levels. They give you calories, but they won't affect your sugar levels. That should be very clear. So I tell them, eat your meat. As long as it is not fried, it's not, try to roast it. Eat your fish. Basically, the sauce is okay. Go ahead and eat your sauce. It has little connection. It won't affect that much your sugars. Then the vegetables, that is our hiding spot. Actually, that is our major player. Fill up your food with the buga, nakati. There's plenty in Kalerwe. We are lucky in Kampala. You guys in the US may have a disadvantage in that area. But in Kalerwe, these things are just thrown away. So let our guys take buga, nakati, spinach, the cabbages, plenty of them. Fill up your plate with all those, but the carbohydrates is only 150. Go ahead and add on a piece of meat, add on a piece of chicken, no problem. I'm not worried about those as long as they're not fried to run away from the oils. And we do that 3 times a day. When patients do that, they actually go off medicines. In between, they actually, if they're using medicines, they start getting episodes of hypoglycemia. The sugars start dropping. Because if you calculate from what I'm giving them close to arbitrary, I'm giving them close to around 1,200 calories, around 1,500 calories that I'm giving them. So that's arbitrarily what I do. I cut down the carbohydrates because the carbohydrates are the ones that cause me trouble. Keep them at 150 per meal. Between the meals, you can throw in a vegetable, you can throw in some nuts. Nuts won't affect your sugars that much. You can throw in some juice with an egg between the meals. So these patients, I encourage them to have 5 meals. They have 3 major meals, but they have 2 small ones in between, or 3 small ones in between. And those small ones, they can take maybe a handful of peanuts or soya with a cup of tea with no sugar, or with take an egg with a cup of tea, so that they don't run hungry in between. So that is one corner that I've cut to loop the complete of carb counting and the other arbitrary methods. I tell them 150 grams, and patients who have followed the 150 grams, they do away with the medicines. Majority of them, either they are so controlled or they do away with the medicines.
So, Dr. Mutebi.
Yes, sir.
Kati mwami Imam Kasozi atulaganye ennaanansi kati sebo ennaanansi wazimuggyako oba wamuwamuka buli wiiki atulaga ennaanansi sebo
Now let us also get this very correctly, very right. Nanasi or any other fruits are actually carbohydrates. So if you take bogoya, gonja, mangoes, jackfruit, pawpaws, pineapples, you take of course fruits are with as many berries, but they have all fancy other things.
We have all of them.
Yes, but in addition you have others that we don't have here.
Yes.
But all the fruits will cause a rise in your blood sugar. So I tell my patients, if you're going to have a fruit, remember it is a carbohydrate. Do not add it together with the other carbohydrates. So, for example, if I wake up in the morning for my breakfast, breakfast, and so nanasi yange. So I will measure my nanasi and I will do my 150 grams in the morning for nanasi. And I want gatako chancha, nemegata mugo and rumonde and matoke together with the nanas. No, because those are the same group. So in the morning, I wear my nanas, eat my nanas. Lunchtime, because those are 3 major meals. Lunch, nanas in chai garindara, nanas in 150 grams. However, chikuta mpima chengendo kulia bikuta masigenda bila, so I wear the inside. Then supper, another 150 grams. The manjagado kulia jackfruit, I will weigh my 150 jackfruit grams, and that's what I'll eat. So the simple method is the nanasi and the other fruits are bigger more category of carbohydrates. I weigh them. No problem. Birie na ye or birida move sport ya mere.
Thank you very much.
That would be my message.
Thank you, doctor.
However, tuna fruits zina sukari omutono that can be eaten on. Remember, I told you between breakfast and lunch, you can eat something in between. Tuna ebitunga oranges, tuna lemon, tuna passion, tulina ne watermelon, tuna ne apples. Now those have got low sugar. The index genda technical, but sukari tali nyanyo ngolinye watermelon. Molide apple, molide actually passion telling is at all, lemon telling is at all, manjarine causing a bit, and then passion juice. Katiezo, nevozi causes na yezi bali waluba kabejaba nene nanasi, papali, jackfruit, mangoes, gonja, lievu, obubundizi, gonja, bogoya. Those ones are treated like any other carbohydrates. It is a meal, and I normally encourage my patients. The fruit ezo tugezeeko oziria in the whole form. Buli lwo blending a fruit n'ogisengejja fiber oba ogiyese mu kasengejja. Wegamba bw'oba onookola juice ekikopo kimu weetaaga emiyembe ng'ena okukola ekikopo kimu. Ye tebemba ndidde buli sijja kulya miyembe ena, nja kulya hafu ya miyembe. So it's better to be eaten whole. Olya whole fiber oli akuyambako, then the sugar doesn't rise that quickly. That would be the simple message about the fruits.
Inshallah. Oh, okay. Doctor, before you raise your hand. Doctor, I have a question about sweeteners.
Which one? The sweeteners?
Yeah, the sweeteners. What was sweet and low, whatever. Sometimes people use artificial sweeteners. What effect do they have on the blood sugar? And secondly, some people say it's better to drink honey instead of sugar because honey is healthier. I just wanted to know what your comment is on that. And there's another one, stevia. I don't know why Uganda, JD. Now, yeah, what is honey, artificial sweeteners, regular sugar? What is the best thing to avoid, or what should be the best thing to use?
I normally find difficulty talking about something Katondanga Chogirako. I really find difficulty. But honey, what I can say about honey is that the sugar, a rise in sugar far higher than honey. Honey is also a rise, nekaba. Now, normally what I tell patients is that too much of something good or sort of chonona. So honey mulungi, now because some katono, for example, echikopo echa 300 mils, echikopo echono because amatagange ngenda ganywa, so I can put in echijiko chimu echa honey, the tablespoon emu. Neka do yakusanga omuntu akute 300 mils, atademu ejiko bya honey bina. So you are making something that was good, no chifula chibi. Chiringa dates. Dates batugamba tulye dates musanvu eza ajwa katezo ziba nungi if you stick to the 7, that is okay. Nebo njano gamba tino ogenda kulya dates nolya too many dates, then you run into issues. So really about the honey mulungi 300 mils, take a much jiko chimu just to give you the test, really the test. The test changes, no guarantee what you're drinking is okay. Then you had asked about, sorry, the second question. The second question was about?
The sweeteners. The
sweeteners. Now the sweeteners are okay. Katinga stevia comes from plants. It is just a sweetener, causing into your sugars. However, there were some studies and some sweeteners, some carcinogenic effect, and they were called off the market. So my quick suggestion is to use the ones that are plant-based, because stevia comes from the plant. It's plant-based. So that's what I normally give my patients. The others, because of the other things that may come up, I prefer the one that is plant-based. And but generally, all sweeteners wouldn't cause a rise in your sugars. They are just sweeteners. They just give you that false. They deceive the brain that you are taking sugar, yet you're not taking sugar.
Okay, inshallah. Barakallahu fi. Sister Neofa, you have your hand up, your co-host.
Yes, I did. Doctor, when the doctor answered it anyway, because badengena mugamba nti ishe ndala jetu funa bwogamba abantu nti it is okay to eat. Ekizibu kye balya bingi, especially wekituuka ku fruit. Owulidde ayagala doctor yangambye ndye ennaanansi, ajja kulya ennaanansi namba.
Banange kankiddemu fruits zonna ziringa mmere. Emmere abalwadde bange mbagamba 150 grams. So balya ennaanansi agirya mu sport ya mmere, it substitutes food. So bwendya ennaanansi mbeera nga alidde ekyenkya. So bwenkera ku makya ne ngamba ngenda kulya muyembe gwange, I weigh the mango. Gafu sijja kweringa kisigo kwa sigenda kirya, nja gusala gwengenda okulya nguteeke ku sowaani. So I weigh the net mango gwengenda okulya 150, and that is it. Demba nali omulala nakulya kulinda ku time ku dinner ekiro.
Omuntu atayina scale.
Yes.
Atayina weighing scale. Kati jajjanga yali eri embuulire. Ate abo bo balina ekizibu ddala nga bali ku insulin. Dokita yangamba nina okulya ekyenkya seekuba insulin nga siridde emmere. Naali omuwombo gw'emmere ku makya, naali omuwombo gw'emmere ku lunch, naali omuwombo gw'emmere buli kaseera aba alya.
Now this is another figure I give them.
Bemanyire kabe bange. tebajja kunyiga
abitwale figure gyemba wa yino kozesa ekikonde kyo wisonti ekikonde kyo kyenkanankana ne 150 grams. So ekikopo kyo ekikonde kyo bw'okifunya kikuwa just 150 grams. Kati ekikonde ekyo kirimu obumonde bw'olidde obumonde bw'edda obumonde nga busatu. Oba olidde lumonde era ogereganya ekikonde kyo bwe kyenkanya lumonde gw'olina ogenda okulya. So as long as akamere ko kenkana n'ekikonde kyo, no problem. Ya carbohydrate kati problem yaffe gye twalina tukola. Oli ajja abalwadde oli n'ateekawo akawunga 150, n'ateekawo lumonde 150, n'ateekawo n'obumonde 150, n'ateekako ne chapati. Nedda. Anything to do with carbohydrate nti emmere njogera ku muceere, kawunga, mayuuni, muwogo, lumonde, Irish, chapati, muwogo, bugatti, byonna biri under carbohydrate obipima ne fruits byonna biri under carbohydrate obipima n'okola 150 in the morning, 150 ku lunch, 150 kiro. Oba tolina scale kozesa ekikonde kyo, emmere erina okwenkana ekikonde kyo. Oba tolina ekikonde kyo weeralidde kiyinza okubeera ekinene ennyo, oba walima nnyo, oba wakola ki, oba kitono nnyo, ng'okozesa obumonde busatu nga buli kamu kenkana ng'eggi. Kamu bubiri busatu. Each of them nga kali size y'eggi, obumonde busatu bukola 150 grams. Kati oba onoolya emmere endala ebeera ina size eri equivalent approximately bwe watyo n'ofuna some arbitrary measure. Otherwise naye nga abalwadde abafollowing that abalwadde bembadde ndaba bonna they get very very good control. Era omulwadde senga ajja nga ayiseewo ayiradde ebba inaga nti musawo naliddeko chapati. Kati waliwo something else tulina okukola ku balwadde baffe, maybe it is important to mention nti oli ayinza okugenda ku pate balinayo embaga balinayo okwanjula bannange temwe restrictinga embaga ejja once in 3 years okwanjula kujja once in 5 years ogenze bakuyise ku birthday bage imamu ayinza okugamba birthday tebazikizinga ne waliwo abakuyise ku kabaga konna waliwo abava emakka waliwo bagenda awuli emmere yo
every weekend.
But that is every weekend you have to factor in but if it is coming rarely, I mean to erumya nnyo olwo lyemmere yo tuli mu idi azuba geno lyemmere nalidde nyingi ku idi kati nako eziddako ng'osala ng'olya katono ng'olya vegetables nyingi okusinga mmere endala. So really ku pate abantu baleme kwerumya, let them get that break. At times we call them diabetic breaks. Tukikwanya ne mubana abato agenze ku pate muleka ali cake ali ice cream we ali ebiki abanako can always adjust the insulin for that particular day. Kati ng'abantu abali ku ddagala ayinza okuba nga alidde emmere nnyingi mfo ky'okumira empeke emu ya metformin n'amira bbiri n'amanya nti twabadde ku kabaga eyo n'alidde emmere nnyingi nnyo nga eddagala lyongeramu katono waggulu just for that day sukaali aleme kulinnya nnyo, but that comes once in a while, so really tebalina kwerumya nnyo. Twagala nnyo omulwadde wa diabetes asigale obulamu bwe nga bulinga obulamu bwe bwali badde, agenda ku pate alya ku ice cream alya cupcake naye alina okwegerera. Yes.
Dr. waliwo agambye naye ekikonde ky'emmere kweri tugenda kufa enjala.
What I do for my patients, by the way, as long as you have gotten the control, kati nga tutandika okwadyasinga nga kugamba nti katwale tulya kiringa bw'obeera ng'omwana yali misbehavinga ku ssomero wamuwa miliyoni namba omwana wa P5 n'atandika obutasoma n'akola ki, kati baatandika okuyita aleta ripooti nga kati enamba 1 yasinze mu class ng'ogamba nti wali osooka n'ozijjako nga sigenda kuddamu kuba pocket money etako emitwalo 2 gy'ogenda nagyo, njagala osome njagala goba osinga mu kibiina. Bamala okusinga mu kibiina then ng'ojjangu ati naye omanyi nakuba kiri emitwalo 2 kati ngenda kukuwa emitwalo 3 oba 4 baakoma ng'akoze bulungi ng'omugala akakati ngenda kukuwa 6. So similarly mu body betugezaako to starve it ebeera ng'esoberinga up, it actually resets. That is one of the benefits eziva ku kusiiba. Whenever you fast, you are resetting that body, you are fine-tuning it. We come out to normal, nga tujiwayo reward, nga tukola ki, nga wadyasinga wadde ku 150, nga tubulaza ku 200. Osugala nga sukali alyoke, body eryoke, nga tudda ku 250. Oba olyoke nga tudda ku 300. So tugenda twadyasinga mpola ng'omwana akoze obulungi n'omuriwardinga. Kati oba omaze ogiresettinga, eddamu neeterera ne tuddayo ku normal behavior yaffe. Naye nga bwe tukipinga watch nti sukaali katutukako kuba tumukeberako.
Inshallah. Doctor, ate bagamba nti mbuno abagamba nti nalidde nnyingi naye njagendamu exercise, njakola exercise, njagibaaninga kanneeriire. Oba bamu ab'Uganda bamanyi ogamba njagenda mu sauna. Ne bagamba nsala ku masavu.
Anti kakati if you are able to for example senga ngenda ne manya nti nalidde emmere nnyingi kange neziruke nga you are able to match what you're putting vis-a-vis ky'ofulumiza kyalibadde okay, very okay. However, the downside nti emmere eno buli lw'oli emmere ne weemanyiiza bboda okubanga oli emmere nnyingi, emmere naye eri addictive, very addictive. Otuuka nga gwe olina okulya enkoko yo, olina okulya chapati yo, tolabira ddala waki nsobola okulya grams 2 eyakamere. Kati emmere eri addictive, ojja kutuuka nga tosobola kukola exercise naye ng'ate emmere wagyongeza nga emmere gy'olya nnyingi nnyo. So tugezaako okugamba nti nedda tewesindika into that kind of body kutuuka kumanyiira nti no ki emmere ebeera nnyingi, otherwise you run into trouble. But otherwise senga oba osobodde nti ndidde emmere nkoze exercise baanizawo the food gye ndidde, it would have been okay. But ojja kutuuka nga tosobola kukola exercise, amagulu gakuluma. Kati Kampala obudde bunyogoga, enkuba etonnya, meanwhile olidde emmere nnyingi kati ogenda kujogingirawo. Oluusi okooye tosobodde kujoginga, kati emmere eri gy'olidde nga yeetereka ate mu yeetereka ekola damage within the body kye tuba tetuyagala, what we don't want. So my advice would be exercise zikole, negezaako okunakyalingayo body into okuteekamu akamere nga katono. Wakiri n'okolamu periodically n'oga nti okay waba olwo n'ogamba nti okay kandiastingemu naye nga routinely bode ogimanyiiza. Ate ekintu ekirungi nti bode bw'ogimanyiiza ekintu etuuka n'ekimanyiira. There are some people ye nga tanywera ddala sukaali nga akimanyiira nga oteekamu ne sukaali awulira nga agala okusesema. Olina abantu nga ye ataliira ddala, I know friends of mine nga taliira ddala nnyama, nga tayagala kintu kisiike oba tayagalira ddala kintu carbohydrates ze nga alyako ntono nga bali okusukka wawulira ddala nga body yekyanga. So you can nurture body n'ogimanyiiza okubeera nga behaving in a certain way. Mulungi nnyo.
Yes, inshallah. Barakallahu fi. Hajuna Lumoso. Doctor, I have a question. How much more time do we have?
You are the host.
You're the one.
Do members still have any questions?
Walwa wanise Hajina Lumoso nakwadde yakazindalo. I don't know, let's see.
Oda tuna kampa chojo kampe. Kakati, salamu alaikum. Kakati. Dr. agambye omwana omumanyiiza 1 million n'omussa ku mitwalo 2. Ekyo olaba kiyinza okumukolera omwana oyo. Ayinza okuba temde oyo w'emitwalo 1 million ku mitwalo 2. Neoba okigezezzaako wadde wano mu UK. Neoba okigezezzaako wano mu UK oli mumanyiiza emitwalo 2 ewiiki omuze ku paundi 1.
Hajina Lumoso, obuuza
ewangi. Of course, kati Haji, difference inakoze nnene. The difference inakoze nnene, but in real life, what happens is like this. So Echomwana was just an example to help us understand the concept. But by and large, body, Kaba Katonda wa Ramadan, body ne sobering up. It is basically drawing up back, no got amaloku redesigning amu. Probably bobera ngo mwana omwadde omwaka kadde. Weso ngamba ati abadde kwadde kakadde kati ngenda kuza ku mitwalo 2.
Okay, so.
Yes, but the important message is really to try and reset our body.
Yes. And yes.
So the important point is really to try as much as possible we can to adjust down, to downplay, because betuwa a body of a merenga nyingi, ate banange tukigenderere. emibiri gyaffe ogina we gituuka nga tukyaswana ku exercisinga kasooweza emyaka 45 exercise ifuuka nzibu nnyo obeera bize ova ku mulimu okooye. You can imagine for me I live work every day almost hour 2 on a daily basis kati exercise ngenda zikola ddi. So the quickest thing for you okwekwekamu mmere nobanga ova eno wansi body era tulina okunachalinga ennyo abaana baffe kiyinza okuba nga kiri late for us naye abaana baffe tulina okuba nachalinga okulya vegetables. Abaana bamanyi okuganirira ddala okulya vegetables. Abaana vegetable ogenda ozibawa ne bazisindika ne balyamu buli bijanjaalo nyama ne balyamu nyama yokka. No, abaana tulina okuba nachalinga right from the start. Ne babeera nga one bali used to okubeera nti tebalya plenty. Number 2 nga balya lots and lots of vegetables. And then number 3 balina okubeera nga bali active. Ne bakimanyira ne kibeera nurtured into their systems. Nti bakola exercise, akamere balya katono. So that once they get up into age bracket nga tokyasobola ku exercisinga. Body already ebeera yakimanyira dda kuva wansi.
Barakallahu fikum. Okay, well, your brother Yusuf Semwanga nakoda kazindawe.
Assalamu alaikum warahmatullahi wabarakatuh.
Alaikum salaam warahmatullahi wabarakatuh.
Dr. Nkulamusiza kakati
Esewo
nzizeemu koleti mukko mbadde naakayingira naye topic enkotteko ya diabetes kati question yange ebimu sibiwulidde eri olwokuba tibadde naakajja. Nnyinza okubuuza kyembuuza nga ate wakinyonyoddeko dda naye question yange eri ku diabetes nti abasawo abasinga balikomendinga naddala ng'olina type 2 diabetes balikomendinga metformin naye nasomako wano nga ndaba side effects za metformin nga ndaba nnyingi nnyo n'obulazi bizikuleetera bingi. Oadvisinga ddagala ki eritali metformin ate lino eddala lino eri Uganda habos biki olaba nti omuntu newabikozesa tebirowalinga gundi sugar zo nga gundi nga metformin. Omuntu ayinza osigala nga amukozesa byoadvisinga ki ku gundi ku ddagala ng'erya metformin oba waliwo ekika ekirala nga omuntu ayinza okukozesa. Metformin ndaba
Thank you very much, Brother Yusuf.
Yes, sir.
So Yusuf, thank you very much, Haj Yusuf. Egundi metformin, unfortunately, I would say unfortunately, or fortunately, nti tekiki nagambye nti abantu bonna abakola amadagala agali modern bagacheckinga buli kamu. Ekintu ekibeera nga kyahappeninze ng'otesinza abantu miliyoni emu ne wabeerawo omuntu omu baati afuna ssenyiga ng'obatestinga nga olina okukawandiika nti bwe nali nkola trial omuntu yafuna ssenyiga naye bw'aba nga ssenyiga oyo ayinza oba tali connected ku ddagala eryo bakwetaaza nti okawandiike nti eddagala lino lyakola ki lyaleeta ssenyiga. So bw'osoma leaflet y'amadagala gonna ojja kulaba ebintu bingi ku kalisi ako akabeera munda akapapula ne bata metformin ne bw'osoma busomi panadol n'eddagala ki is because babeetaaza ekintu kyonna ekibadde ne bwafunafunye accident bakiwandiikamu nti no eddagala lyakoze accident naye nga ate ebingi nnyo nnyo biba tebireeted ku ddagala eyo. Kaakati tulina amadagala mangi nnyo amalungi. Kye naaligambye nti amadagala gwe g'okozesa waalibadde okozesa eddagala ne bwaba metformin gwe n'olaba kituukawo ng'omukozesezza bw'abeera nga kolera no problem. However, obanga tosoboddemu okozesa tulina amadagala amalala mangi nga bwe nagambye nti leero saagenze nnyo mu ddagala lya diabetes naye nga tulina ebika bingi nnyo, tulina categories endala almost nga 6 endala ze tusobola okukozesa that esobola okuwa drop mu sugars bulungi nnyo nnyo nga togenze kuna ku insulin. Abalwadde baffe batya nnyo insulin naye tulina amadagala mangi amalungi agasobola otuyamba n'otogenda wadde ku insulin ne gassa sukaali. Of course tegayinza kutuuka ku metformin. Metformin is one of the drugs a drop ennungi ddala compared ku madagala amalala naye n'amalala gagezaako okwagala omutuukako kuba effect y'emu. At times tumanyi okugagatta waliwo empeke zetulina nga gali combined tugezaako, but of course in addition exercise nga bwe twogedde diet nga bwe twogedde tuba tulina ozigattamu in addition ku madagala so that we get very, very, very good control. Otherwise, session ey'amadagala tugakozesa ddi gatuwa effects ki tusobola okuteekayo session that is specific ku bantu abalina abantu abalina diabetes oba abajjanja abantu ba diabetes tetugenda now into y'abantu bokka bokka abalina diabetes particularly kwabo in another session tugenda mu details badagala ago tugakozesa tutya adjusting tutya insulin tubakozeseza mu adjusting otya tuyinza okuteekayo session specific for that special category of people.
Inshallah.
Onookomawo Dr. Ulala kubanze nze bigenze ebisinga ku gundi ku topic eno baba onookomawoko lunaku olala.
Tujja kumukomyawo tulina okusooka okuwakinga out ne schedule ye naye nga bw'agambye tujja kubayo ne session.
I'm always available. Muchala Hasfa ina contact zange. Imam Kasozi is a great friend of mine. They can always contact me anytime. Nilfa ina contact zange. Many people can always contact me. I'm very available.
Inshallah. Oba tukaisawo kati doctor. Tukole session eddako next week so we can go hand in hand with management and medicine.
Medicine, no problem.
Yes, doctor. Medicine is very important one. Very important.
Okay.
Again, so
okay. No problems. Tusobola okukola session eddako so that now we got proper. Now it will be only the medicines.
In management and the medicine.
Lukola medicines, maybe n'abalala abayinza okubeera nga balina ebibuuzo ebyaliyagadde okuraising in between. The wake-up vein. One about to Gamazo Gezako 150, Nibalaba Wekola, then we can roll it on. Inshallah ta'ala. Around that time, please know how to deal with because diabetes is other things of treatment. How frequently at home
neither wounds associated because nazukati nyingi apparently.
Yes, ebiwundu ensigo kati now my brother and so mukamomo, candidiasis. If somebody has got ED, how do we go around the dysfunction and all that details and all those details?
Inshallah.
Mbadde aba omwami n'abuuziza nti amisinze mugambe about the link. You can listen to the link.
Sebo mwami Semwanga osobola ogenda on YouTube ku Oma Connected. Ogenda ku YouTube Oma Connected session ya leero ejja kubeerayo. And next week inshallah nga Dr. bwagambye the same link nga gye mukozesezza leero ejja kuba the same link that you use. And at the same time Legino emisomo gibeerako ku Oma Connected ku Facebook. On our Facebook page bw'ogenda no clicking ku Oma Connected on Facebook. Your name is emisomo gibeera recorded gibeerayo both on YouTube and Facebook. Inshallah. Doctor, one more thing about community sensitization. Abantu baffe so many times do not know the signs and symptoms of being a diabetic. Oba tebamanya diabetic, because there are certain instances I can give you. Was one who passed out nga tebamanyi nti mulwadde wa sukali ne balowooza nti yali afudde naye nga yali ayingidde diabetic coma. Another incident was a friend actually that I knew that was a gentleman who had a problem with erection. Naye nga anoonya eddagala erimuzzaamu amaanyi naye n'okwebuuza nga mu baana banna baaki. He had come to visit here in the US and ayagala kufuna ddagala naye only to go back home and I think he passed out only to discover that his blood sugars were extremely over the roof. Naye abantu baffe tebamanyi okunywa amazzi okubeera thirsty nga bw'ayogedde okeera ku makya obanga bawuliranga those pins and needles in their feet naye nga tebalowooza nti oba sukaali. Kati abantu baffe do not know these things. Kati how are we going to continue teaching our people and sensitizing our people nti bw'ofuna ebintu bwe biti manya nti maybe genda bakebere sukaali kuba nekya nga sister Nilfa yagambye stigma weeri abantu batalagenda kwagala genda mbasawo naye they also don't know some of these things nti maybe that could be a sign of being a diabetic.
Now, that's a very important point, Jolie. I didn't know that I wouldn't know about binary sign jebafunye oba symptom. Naye omulwadde wa sukaali nga bwe nagambye majority talina kyawulira completely nga atambula butambuzi najja amawe mu ddwaliro naga nange musawo bankeberekokko bagenda omukebera ng'alina sukaali. So sukaali can be very silent. N'ekirala abantu baffe ndoza tugenda kufuna engeri how kugamba omuntu n'akifuula routine nti maybe after a certain period neetaaga okukola check-up. Naye bwe nga sirina ssente kale to the bare minimum kale waaki bankoleyo ka sukaali as a check-up, as a routine check-up. Nomanya nti I have patients bemmanyi ng'oli baakeberako sukaali we mu January ng'ali normal. Agenda okuddamu somewhere kati agenda okujja okundaba najja katugambe mu April. Agenda okuva mu April nga sukaali ali waggulu nnyo ng'ali ku 20 millimoles per liter. So kiba kitegeeza nti wali yali normal naye mu myezi esatu the body has flipped and now has become diabetic. So sukaali bw'atyo bw'ali asobola okukyuka even within weeks, within months, n'ofuuka nga agenze waggulu nnyo. So omuntu yali badde nga tasukka myezi esatu nga tafunyeeko agenda nti abaaye munkebereko ka sukaali. Nga bw'olaba pressure ne sukaali byali badde nti omuntu tasukka myezi esatu nga tebamukebeddeko, especially baba omuntu oyo ng'agenze above 45 to 50 years of age, because age tugirabye omuntu yenna kasaasuka age bracket eyo naturally diabetes aba around the corner. It is coming. It's not that it will come, but the chances of it coming ziba zeeyongeddeko. So bw'oyingira age bracket eyo kyalibeere kyonyina okebezanga every emyezi ng'esatu so that tukikwata ale bw'okikwata ale by the way n'okutamira ddagala ngera bwe tujja okulaba when we do the treatment. We can just do diet and that's it. Nokola exercise or diet and that's it. Ate kikwewuunyisa ojuga bwe graph eri, I showed you a graph where yabadde erinako section nga kuliko abantu abali pre-diabetes. Now the pre-diabetes.
Yes. Dr. Laika freezing.
Kuwana nnyo nti buli myezi esatu wakyokebera nendoza sirina sukaali nendoza
Dr. tukuluzinze. Dr. Laika freezing.
tulina okurutina okukebeza buli myezi esatu. Number 2, kasoolyamu ekintu kyonna ne kipasisitinga ennyonta ennuma.
Doctor, obadde freezing we probably lost about 30, maybe 30 or 45 seconds in byobadde oyogera. We had lost connection.
So mbadde ngamba nti mu pre-diabetes tusobola okuba ku exercise. So tulina okwensuringa nti abantu bonna beekebeza buli myezi esatu sukaali oba bw'obeera ng'olina ekintu kyonna ky'oba olaba ogejja abunumale oba ofukira kumukumu oba ofunafuna amabwabwa abalira mu kamwa oba mu bifo by'ekyama oba UTI olaba abantu abeera UTI neefuka UTI. Sukaali ayinza okuba nga it's a sign nti sukaali ajja ofuna oba amabwa ku skin senyiga kifuba ajja bw'agenda body. So body kingamba for example singa olwaliyo ne kigenda maybe lese nga kigenda maze weeks bbiri nga mpulira ennyonta ennuma nyonta or any of the other symptoms that we discuss is out then wawetaaga okukebera sukaali n'ekirala something else wali abadde akonye
Doctor, your network seems to be going bad, Kat.
Ajoinize imame emawanga.
Amawanga yaterera.
It is about the problem ejjanga tubawadde nnyingi. So omuntu yenna b'abeera nga alidde
we keep losing you somehow. The connection again towards the end where you know this.
So what I was saying is that in terms of the diet, some patients bamanyi okubagaana okulya certain foods. Now, abalwadde baffe tubagamba nedda they are all the foods that they are, but as long as they are legal, but it's about the volume. It's about the volume. Lya kanyama ko nebo ndogamba nti ogenda kulya ennyama because musawo yangambye ennyama tenda kakwate na sukaali nolya ennyama ku Monday ku Lwokubiri ku Lwokusatu ku Lwokuna paka weekend ogenda kulwala tugamba kyusa mu Monday lya ennyama Lwokubiri lya ku bijanjalo ku Lwokuna lya ku bikawo Lwokutaano lya ku kyennyanja ku Lwomukaaga lya ku ntula ne biringanya ne bugga ne nakati ne bikabeji bikyeyo like that. So that we tojja kufuna buzibu. Otherwise abasawo abamba bamanyi okugaana abantu certain foods. Ati waliwo abantu nga bava Kabale balya bumonde waliwo nga talya bumonde aba agenda kufa waliwo abava Arua balya kawunga bannaffe abava mu states baagala nnyo zi burgers baagala zi McDonald's bannaffe abava e Saudi babeera mu muceere bali muzi chapati ogenda mu Europe UK bamanyi okufuna ku matooka abo they have variety bamanyi okukyusakyusaamuko so but kati ogenda okugira oti omuntu omuganda kikyalina oli abanga alina pizza gyalina fine lya pizza yo but pizza eyo tugenda gipima tulabe pizza yaffe how are we going to tailor ebintu byaffe into that pizza. So it is about the volume. Omulwadde tetumugaana kikyagenda kulya in terms of mmere tulina abantu nga bo stable food yaabwe matooke. However, having said that, certain foods have got slightly more glucose changes than others. For example, senga ndya amatooke gajja kumpa a rise in sugar ntono ya kawunga. Naye akawunga nako nakakolera nakalira ku 150 anja kwera wa mulembe kiba tekijja kulinyisa sukaali wange. So really the bottom message that twagala genda nnyo mu complicity into emmere eno togirya erigirye ate eno kolaki, let's keep to the 150. If you use the 150, tewali sukaali ayinza gana getting a control within that 150. Olaba nga otandise okukankana sukaali akendeera nga tuadjustinga eddagala tugenda tulijjako tumala okujjako eddagala atandika okwongeza akamere kaffe. Actually I debate with patients nti oyagala tuggyeko eddagala oba oyagala twongeze akamere. Most of them say musawo twongeze kamere then nga akamere tukongezaamuko nga tudda ku say 200 eddagala tulirekako. Abamu bagamba musawo ndyoke n'akamere kange 150 okendeze eddagala abadde ali ku metformin oba ne fosiga oba ne vildagliptin nga tugamba okay katuggyeko kye kisinga okubeera weak link nti vildagliptin nga tuggyako vildagliptin nga tusigaza amalala bagenda atereera musawo ndi andyoke nga ogenda okupima sukaali wali 555 nga tugamba okay fine tuggyeko kyekirala nga tuggyako fosiga nga tusigazaako metformin bagenda atereera nga metformin yennyini naye tumutema nga tuva ku 1 gram oba twice a day nga tudda 500 twice like that paka eddagala lyonna beriggwako. Eddagala limala okuggwako nga haka tukoze tutya litwongeze kamere as we measure. So bottom message, teri gana muntu mmere yonna. Some workers do that, which is wrong.
Moderation.
It is moderation. The key message is moderation. Akamere konnako obaolidde moderation. Enkoko yakapiisi tulabye nti piisi emu terina kyegenda kukolako as long as ogiridde ku Monday Olwokubiri lya ebijanjaalo Olwokusatu lya ebinyeebwa the sugars will get stable.
Okay, barakallahu fikum Dr. Ndoza, to winding it up. Mwami Ssemwanga tuyiseewo ekibuuzo ssebo mangu tusobole okuta dokita kuba atukkiriza okukomawo next week.
Salamu alaikum hatullah. Kakaki dokita ayogedde ku kya diet. Abasawo bonna abasinga bali commendinga nga bagamba nti emmere yonna egwa erimu carbohydrates omuli kawunga oba omuceere omweru yonna yonna bagigaana eyo. Naye sikutegedde ate gwe mpulidde oli commendinga emmere yonna tusobola ogikozesa kati awo wesitegedde kuba yonna bagigaana eyo naye ogenda okugeza nga esinga yonna erimu carbohydrates chapati biki byonna migaati ebisinga naye bagaana tobirya byonna bireke.
Now what happens body emmere yonna gy'olidde, for example abantu abalya amatooke gokka bali badde tebakula nakula, naye tulina abantu eyo deep down mu byalo nga bategekawo entula zaabwe ne balirako matooke gokka ne bakula bulungi nnyo ne bavaamu ne ba doctors. Otherwise senga ekyo kyali awo bali badde tebadevelopinga. Tulina abantu abamu nga bo area gye balimu balya buli katugambe nga balya buli bumonde bali badde. So in terms of emmere ey'enjawulo bode ejja gikyusa yonna ejja ejjemu sukaali agirimu. Kati ne bw'olya amatooke gokka n'ogalya nga mangi sukaali ajja kulinnya, ne bw'olya lumonde yekka ajja kulinnya, ne bw'olya mayuuni ajja kulinnya, ne bw'olya ki ajja kulinnya. Bottom message gye tuwa abalwadde baffe is emmere gy'oba olidde yonna ejja kulinyisa sukaali yonna. However tugamba gikole moderation. Lya amatooke go kola 150 go, lya kawunga kola 150, lya chapati kola 150. However tugambye nti emmere eyo but usually kiteeka kyaganya kigamba abalwadde batwala that final detail kaso otandika obagamba ate eno kati ate omumonde ate bulinyisa okusinga lumonde bulinyisa okusinga akawunga ate akawunga asinga muwogo tajja bijjukira neobuuza abasawo 100. They will not remember what is superior over what. Kati kyetugamba bottom line nti emmere yonnolya n'ebibala bijja kulinnyisa sukaali. Kyetwagala kola 150 ku makya, 150 ku lunch, 150 mu evening of any food or fruit. Ogipime sukaali aba tajja kulinnya biivinira.
Dokita katumenyeera waliwo kye bayita keto diet ng'omuntu akozesa oba nnyama nkoko byokka nga takozesa mmere eno yonna ndala egwe mu carbohydrates naye ng'abasawo nabo bagamba leero walinga
link Yusuf ogenda gobera link. I try to break down the keto diet, but essentially mu keto diet what they do balekerawo okozesa carbohydrates because carbohydrates ezisinga okuleeta akavuyo carbohydrates mu sukaali, so bagenda baziteeka ku zero. Kati n'asalawo ne energy production from other foodstuffs, either nyama, proteins basically, ne vegetables ne fat. So akwata ennyama n'afuna ekikopo ky'amata oba n'agattako oba n'amagi nga byalya, tagattamu mmere kye tuyita emmere nti lumonde, muwogo, muceere tabigattamu, n'ebibala tabidagattamu. Akola vegetable, fat na protein byokka byalya, and that one aggressively brings down the weight. It brings down the weight, brings down the sugars, systems zonna zitereera. However bw'okikola weetaaga kubeera nga olina target gy'otargetinga ogituukako n'okumongo adjustinga because body ate bw'ogisinye nnyo. Omwami ekyo yadde agamba nti omwana bw'abeera nga omusaavinze nnyo ate oyinza okuleeta. So kati okukola keto diet otuuka n'oadjustinga back mpola, togirekaako for too long. Usually mangi tadde ku balwadde bange. I've done it for my patients. Actually naye bwe bagitandika bava ku madagala oba ne babeera nga bakozesa madagala matono, naye toyagala gikozesa for too long. Gikozesa kusukka myezi 2. Usually ekyewala ennyo 2-3 naye bw'esukkaawo omulwadde aba tasobola gisustaininga. Tesoboka ogenda okulya olya vegetable na nkoko oba na nnyama, otandika okuwulira nga situation ekendeera n'owulira nga nafuwa. So bayetaaga okukola up to a certain level then n'okomawo, but nagyogeddeko mu talk awo oyinza n'ogiddamu when I come back.
Okay, barakallahu fikum.
Barakallahu fikum doctor. Ndowooza ebibuuzo bya leero biweddeyo. We thank you so much for your time, doctor, and all the information and all the education. tukwebaza tusaba Allah akusasulemu bulungi ku duniya ne ku akhira. Weebale nnyo okubeera nga weerekereza your time, your patients, your students, n'obeera nga naffe otutetuka mu program y'okutusomesa. And as you have promised, next week, inshallah, tugenda komawo. Like I said, it's the same link, like I want to this is later. Same time, at least 4:30 Ugandan time. UK time will be about 2:30. US tulija kwa saa kitundu, inshallah. Dr. tukwebaziza nnyo. Barakallahu fikum. Imam Kasozi kwoli nakulabye. Tukwebaza nnyo okubeera nga what recommending the doctor. Thank you so much for your connection with this very wonderful doctor. Saba Allah kusasule bulungi naawe. Nanasi tujja kusigala nga tuzirya Imam Kasozi in moderation. Inshallah. Inshallah. Dr. Tukwebaziza until next week, same time. Okay. Ogambia next week is going to be management and medicines.
Tugenda again into the medicines.
Medicines, okay. What you mentioning the chair management to Chireke, or is just going to be medication only?
Yes. Management is broader because management remove diagnosis, remove diet, remove exercise, remove amadagalagali genyini. Unless you want me to repeat it. But but the major focus will be around the drugs.
Okay, inshallah.
Yeah, inshallah.
Okay, inshallah. Sister Habiba, Sister Neofa, you have anything else to say to Doctor before?
Yeah, it's just to thank the doctor for the session. Barakallahu fikum wa jazakallahu khairan. Katusuubira abantu baffe bajja kufunamu era bateeke mu nkola. Tugenda kuziddayo tetweyanza nnyo tweyanzeege.
Assalamu alaikum warahmatullahi wabarakatuh.
Waalaikum salaam warahmatullahi wabarakatuh. Nange sina nnyo kye ngamba doctor okuggyako okumwebaza. Barakallahu fikum doctor.
Kale, jazakallahu khair.
Nadama next week, inshallah. We'll sensitize our people. We'll do a lot of health promotion that is needed in Uganda.
I know.
Inshallah.
Inshallah. Tuzaako session ya